Hello, my zebras and spoonies. Thanks for coming and hanging out with me today. I'm glad that you are here. Today, I'm going to be talking about my experience with mast cell activation syndrome as an installment in the My Diagnosis series. So, let's start out by talking about the mast cell activation syndrome definition because it's complicated. So, the American Academy Allergy, Asthma, and Immunology Association defines mast cell activation syndrome as a condition in which the patient experiences repeated episodes of the symptoms of anaphylaxis, allergic symptoms such as hives, swelling, low blood pressure, difficulty breathing, and severe diarrhea. High levels of mast cell mediators are released during these episodes. The episodes respond to treatment with inhibitors or blockers of mast cell mediators. The episodes are called idiopathic, which means that the mechanism is unknown. That is, not caused by allergic antibody or secondary to other known conditions that activate normal mast cells. That's the big definition. There are some theories as to what's causing all of this to happen, but they are still in the process of researching this. But this unknown factor really is one of the biggest challenges to having this disease. The money being invested in the research on this is going into figuring out how it works, which is absolutely an essential first step. But that means that there really isn't any well established treatment plans. And the treatment suggestions that are out there are based on expert opinion. And while these opinions have a lot of value, it isn't as good as having the research into it. So, the first signs of anaphylactic reaction may look like typical allergy symptoms, like a runny nose or skin rash, but in about 30 minutes, the symptoms will progress. And then you end up with one or more of a bunch of symptoms that include coughing, wheezing, pain, itching, tightness in your chest, fainting, dizziness, confusion, weakness, hives, rash, itching, swelling, redden, flushing, runny or stuffy nose and sneezing, shortness of breath or trouble breathing, a rapid heart rate, swollen or itchy lips or tongue, swollen or itchy throat, hoarse voice, trouble swallowing, tightness in your throat, vomiting, diarrhea, cramps, weak pulse, being pale. Some people also report feeling a sense of doom right before all of it happens. And symptoms can move to shock and even loss of consciousness. As many as 1 out of 5 people can have a second anaphylactic reaction within 12 hours of the first that is still part of that first cycle. And this is called a biphasic anaphylactic response. Needless to say, this is pretty scary stuff, especially when there are a lot of chronic symptoms that come with having mast cell activation syndrome that include itching and nausea. For me, things generally start out with a runny nose, itching, and just feeling unwell. The first place to itch is almost always around my mouth. When the itching gets worse and spreads to a larger area or onto other areas, I usually feel weak and dizzy. Sometimes I get a rash and swelling skin, and other times I don't. My heart rate goes up, and I start feeling like I can't get a good breath. I also get the nausea, vomiting, and diarrhea most of the time. It's really unpleasant all unto itself, but when you add in the knowledge that it can progress into shock and become more life threatening, it takes on a whole new layer. Adding anxiety into this just doesn't help. And there's no way to have this happening and not have anxiety because it's just scary shit. The things about mast cell activation syndrome is that you don't have allergies. I mean, you can, but it's not part of mast cell activation syndrome. You don't have this thing that you come into contact with and it will trigger reaction. Instead, it is about reaching critical mass. Histamine is a major factor in all of this. When you reach a point of having too much histamine in your body, you start having symptoms. Many things can increase your histamine levels. So, managing your mast cell activation syndrome is about managing and mitigating the histamine release in your body. That means reducing stress, avoiding high histamine foods, eliminating leftovers, taking medications that reduce the histamine, and avoiding any individual triggers are really big key factors. Because mast cell activation syndrome is about having too much histamine in the body, everyone that has mast cell activation syndrome also has histamine intolerance. Because by definition, histamine intolerance is when you have too much histamine in your body and thus are having symptoms. But these symptoms are not yet reaching the point of having an anaphylactic response. Histamine is associated with common allergic responses and symptoms, and many of these are similar to those from a histamine intolerance. While they may vary, some common reactions associated with histamine intolerance include headaches and migraines, nasal congestion and sinus issues, fatigue, hives, digestion problems, irregular menstrual cycles, nausea, vomiting. In more severe cases of histamine intolerance, you can go into having abdominal cramping, tissue swelling, high blood pressure, irregularity of the heart, anxiety, difficulty regulating body temperature, dizziness, and even passing out. Many of these symptoms overlap with anaphylaxis, and this is because histamine intolerant symptoms are the precursor symptoms to the anaphylactic reaction. The layers of complex symptoms can sometimes make it difficult to tell when you should use your EpiPen or when you should seek medical support, and that unto itself is very anxiety provoking. I personally have EpiPens and try to remember to carry both with me wherever I go, but my ADHD often gets in the way of that, and I usually don't remember to bring them with me. Luckily, I have a husband who does that for me because he's amazing. Just realizing that you don't have your EpiPen with you can be super anxiety provoking. It's easy for your brain to go into that what if mode. Um, so I live with the symptoms of histamine intolerance on a daily basis. I get headaches, congestion, fatigue, itching, and digestive issues and nausea. They're all common occurrences in my life. I have well controlled migraines at this point, but they are definitely a thing in my life. And this is the same for an irregular menstrual cycle. I've never been that regular. So I struggle with this stuff all the time. Incidental exposures are super common and they're all too easy to occur. And incidental exposures are when you accidentally encounter a triggering substance with no intention of doing so. For me, this is most often bleach. If my histamine levels are okay, then I'll just go into having some histamine intolerant symptoms. But if my histamine levels are already high, then this kind of exposure can mean going into an anaphylactic reaction. We can control our environments when we are home and make sure that these kinds of things are not around us there. But we don't really have control once we leave home. And there are times that visitors accidentally bring triggering items into your home with them. It's this lack of control that is so scary about all of this. There's no way to factor in everything that can increase my histamine levels and avoid every trigger every day. There's just going to be exposures. That's what's real. And there are going to be stressful days. And no matter how good the regimen is, there are going to be episodes that progress into anaphylaxis. And each one of these episodes that go into anaphylaxis is life threatening. So, yeah, it's stressful stuff. And just thinking about it too much can increase my histamine levels. I mean, that's just how wild this stuff is. Well, I think that's about it for my rambling today. So thanks for coming and spending time with me today. If you like the material, then click the like button, give it some love. It really does help. And until we talk again, you guys take care of yourselves. Bye.